Low blood pressure hypotension occurs when the force of blood against the walls of the arteries is lower than normal. While blood pressure naturally varies throughout the day and can be affected by various factors, persistently lower blood pressure may be a concern, particularly if it leads to symptoms. Causes of low blood pressure: dehydration, loss of fluids from vomiting, diarrhea, or excessive sweating can reduce blood volume and lead to low blood pressure. Heart conditions: bradycardia, abnormally slow heart rate, heart valve problems, issues with heart valves affecting blood flow. Heart attack can impair the heart's ability to pump blood effectively. Heart failure: the heart is unable to pump enough blood to meet the body's needs. Endocrine problems: adrenal insufficiency, Addison's disease, impaired production of hormones by the adrenal glands. Hypothyroidism, low thyroid hormone levels affecting metabolism and heart function. Severe infection, septic shock. An infection that enters the bloodstream can cause a life-threatening drop in blood pressure. Blood loss: significant blood loss from trauma or internal bleeding reduces blood volume, leading to low blood pressure. Medications: antihypertensives, medications used to lower blood pressure, can sometimes cause hypotension. Diuretics can lead to dehydration and low blood pressure. Antidepressants, some can affect blood pressure regulation. Nutritional deficiencies: lack of essential nutrients, such as vitamin B12 and folate, can lead to low blood pressure. Postural hypotension: a sudden drop in blood pressure when standing up from a sitting or lying position, often caused by dehydration or medication. Pregnancy: low blood pressure is common during the early stages of pregnancy due to hormonal changes and increased blood flow. Symptoms of low blood pressure: symptoms of hypotension can vary and may include dizziness or lightheadedness, especially when standing up quickly; fainting, a sudden, brief loss of consciousness; blurred vision, difficulty seeing clearly; nausea, feeling queasy or unsettled; fatigue, persistent tiredness or weakness; confusion, difficulty thinking clearly or impaired mental function. Diagnosis: medical history. Discussing symptoms, medical conditions, medications, and lifestyle factors with a healthcare provider. Physical examination: measuring blood pressure in different positions, lying, sitting, and standing, to assess for postural changes. Laboratory tests: blood tests to check for anemia, dehydration, or hormonal imbalances. Electrocardiogram (ECG) to assess heart function and detect irregularities. Echocardiogram, an ultrasound of the heart to evaluate heart structure and function. Tilt table test, a test to monitor how blood pressure and heart rate respond to changes in position. Treatment and management: lifestyle changes. Increase fluid intake, drinking more water to help increase blood volume. Increase salt intake, adding more salt to the diet under medical supervision to help raise blood pressure. Small, frequent meals, eating smaller, more frequent meals to avoid postprandial hypotension, drop in blood pressure after eating. Medication adjustments: adjusting existing medications, changing or discontinuing medications that may be contributing to low blood pressure. Medications for low blood pressure: in some cases, medications such as fludrocortisone or midodrine may be prescribed to help raise blood pressure. Compression stockings: wearing compression stockings to reduce blood pooling in the legs and improve circulation. Gradual position changes: avoiding sudden movements, changing position slowly, especially when moving from lying down to standing up. Treating underlying conditions: managing any underlying health issues contributing to low blood pressure, such as diabetes, heart conditions, or endocrine disorders. When to seek medical help: if you experience severe or persistent symptoms, such as frequent fainting, severe dizziness, or confusion. If symptoms are interfering with daily life or worsening despite making lifestyle changes. If you have an underlying health condition or are taking medications that could affect blood pressure. Conclusion: low blood pressure can be managed effectively with appropriate lifestyle changes, medication adjustments, and treatment of underlying conditions. Consulting with a healthcare provider is essential for diagnosing the cause of hypertension and developing a tailored treatment plan to address the issue and improve overall health and well-being.